Brush up on your dental care with today's professional, featuring Lima Dental Associates, where you'll always receive state-of-the-art technology with state-of-the-heart care.
Welcome to today's professional. Today, Lima Dental Associates. And with us in the studio is Dr. Erik Risolvato. Good morning to you again,
Good morning,
sir.
George.
Now, the last 3 weeks we've been talking a lot about dental implants in all sorts of ways, with the dentures and with individual teeth and things of this nature. I've heard recently about mini implants.
Okay, very good. Yeah, so that's a good question. People come in asking about mini implants all the time. If you get on the internet and start doing some research about dental implants, you're inevitably going to hear about mini implants. Usually when people come, they want a cheaper solution when they're asking about mini implants. They've heard that they're less expensive. And generally that's the truth. We've been doing mini implants in the profession now for about 15 years. If you remember, we've been doing traditional implants for about 70 years.
Right.
So we don't have as much longevity or research on these. Basically what mini implants are, they were small diameter implants. So where a standard implant might be somewhere between 3.5 and 6 millimeters in diameter, a mini implant might only be 1.5 to 2.5 millimeters in diameter. So they're a very good solution for people that don't have a lot of bone. Right. Or for people that don't have as much resources financially, so you need a cheaper solution. There are downsides to the mini implants, but when it comes to securing a denture in the mouth, and that's what we're talking about specifically here this morning, we're using them for denture support. If you can get 5 or 6 mini implants in underneath a denture, you can get really good support and have a pretty solid situation. I like to give people the options of a mini, but only when we've also discussed all of the other options to conventional implants. Right. The biggest downside to a mini dental implant is that what is in the tissue and in the bone is also what is through the tissue. So it's one piece.
Yes.
So if you pick mini implants as a choice and then you come back a couple of years later and change your mind, we have to remove those mini implants and change to a different system. So there are downsides to mini implants, but under the right circumstances for the right people, they do have a really good solution. We use them in dentures like the models I have up here. It's a lot like the conventional model that we have, and you just have little connectors inside the denture and implants in the tissue and the bone, and the dentures just kind of snap up there. On a maxillary or a top denture, if we can get 6 of those minis in, we can actually remove the roof of the mouth or the palate from the denture. Really? So now you can taste your food again. So that's mini implants. We're running a special right now, normally $3,500 to secure a denture, but we can get it done for about $2,000. So come on in and have a talk with us, and remember to keep smiling, sharing, and caring.